I'm so glad to have everybody here, and I'm really excited to be joined by two amazing panelists who will get to introduce themselves in just a second. Welcome to this webinar on domestic violence and sexual assault resources in the Upstate, specifically as they relate to the LGBTQ plus community and COVID-19. My name is Ethan Johnstone. I'm the lead community builder for PrideLink, a community-based nonprofit here in the Upstate that serves the LGBTQ plus community through health and wellness services, access to resources, and social support. This webinar is part of our new programming, PrideLink Online, and it's in response to the coronavirus and social distancing guidelines. We knew that it was really still important to bring LGBTQ plus people the opportunity to connect, access resources, learn new tools, and we know that it can be really difficult to know what resources exist right now. So I really hope that this is helpful in navigating that. Before we get started, I want to just mention that this is a webinar platform, so everybody's audio and video, other than the panelists, is going to stay muted throughout the webinar. But we want to make sure that you get your questions answered. So at the bottom of your screen, you should see a Q&A box. I know a lot of folks are already engaging in the chat, and that's awesome. But for specific questions that you want the panelists or myself to answer, be sure to put those in the Q&A box. Because of the sort of sensitive nature of these topics, you are able to ask questions anonymously. So be sure to use that feature if you feel more comfortable doing that. So all of the housekeeping is out of the way. So let's get started with our panelist introductions. Anna, let's start with you. Why don't you tell us a little bit about your organization and what you do there?
Hi, thanks so much. My name is Anna. My pronouns are she, her, hers, and I work at Safe Harbor. So we provide a continuum of services to survivors of domestic violence, everything from emergency shelter to counseling, advocacy, child and family counseling, and I do outreach. So I do stuff like this, especially now during the coronavirus, social media, and getting the word out there about domestic violence and our services.
Awesome, thank you so much. Jenna, how about you?
Hi, my name is Jenna Toney. I'm the Community Outreach and Volunteer Coordinator at the Julie Valentine Center. I'm also a victim advocate. Julie Valentine Center is Greenville's sexual assault and child abuse or children's advocacy center. And we're here to provide services for survivors of child sexual abuse as well as adult sexual assault. We provide therapy services. We provide crisis intervention through forensic interviews and emergency room accompaniments. And I'll talk a little bit more in a bit about what we're providing right now. I'm also responsible for a lot of the outreach on our social media, doing webinars like this and participating with our community partners. And I also supervise and train all of our volunteers that provide direct victim services on our 24-hour hotline and in the emergency room.
Awesome, thank you all so much for what you do and for your organizations. So I think when a lot of people hear the words either domestic violence or sexual assault, they either think of the most extreme cases or they think of it as something that might not really affect them. So Anna, can you describe what domestic violence is and how somebody would know if they're experiencing it?
Yeah, so when it comes to domestic violence, it's typically in a relationship, a romantic relationship, and typically an adult or a teenager, they're using a variety of tactics or techniques to have power and control over their partner, and it can look really different. So obviously, if someone hits you to intimidate you or to hurt you, to keep you from doing something, that's domestic violence. But if someone also uses other tactics like keeping you from your friends, maybe manipulating you emotionally, putting you down emotionally, all of that is also domestic violence. It's relationship abuse. And the main thing to remember is that they're doing it so they can have control and power over you. And it can look really different. So for more details, we can talk about it later, because I do want to give time for to Jenna to talk.
Thanks, Anna. As far as sexual assault goes, you know, a lot of people think of the stereotypical, you know, stranger danger, date rape instances whenever they're thinking of sexual violence. But the truth is most cases of sexual abuse and sexual assault occur between two people that know each other. Usually it's interpersonal violence where it could be a caregiver, it could be a friend, it could be a family member, it could be a classmate, someone trusted and known to that person, but it's any unwanted sexual activity. So it could be a touch, it could be someone who's fondling someone, it could be sexual assault or rape. So sexual assault is a continuum of sexual violent acts. And like Anna said, when we're thinking about power and control, that's a huge factor into why perpetrators do what they do. So sexual assault is a continued behaviors of unwanted sexual touch, forcing someone to perform any type of sexual act without explicit consent.
Yeah, thanks, y'all. I think it can just be really helpful to hear the definitions of that and some signs to connect folks to. So I think it's also helpful for us to make the connection between these issues and the LGBTQ plus community and the intersections of those. So Jenna, can you talk a little bit about those issues?
Of course. So, you know, when it comes to sexual assault, which is our the nature of what we do at the Julie Valentine Center, we see a huge overlap with domestic violence. Sexual assault is often used as a form of power and control, as one of the many ways that abusers, perpetrators hold power over someone in a domestic violence relationship or in a violent relationship. As far as the LGBTQ plus community goes, we know that anyone can be a victim of sexual assault or child sexual abuse, but specifically those in the LGBTQ plus community see higher risk for becoming a victim of sexual assault or even domestic violence. And then specifically whenever it comes to reporting those crimes, there's even higher barriers to receiving services. A lot of the stigma that's around sexual violence can be heightened whenever it comes to being a part of the LGBTQ community, and specifically those in interpersonal relationships with other members of the LGBTQ community. They will use that community as a isolator. So if you tell, you will lose your family, you will lose your community. The ways in which people are already isolated and biases are formed against the LGBTQ community when in regards to law enforcement can be an included barrier in that. And then also trusting that there are community agencies that are safe and culturally competent to be able to provide services to those particular clients. So we definitely see an overlap in all of those issues.
Yeah, Anna, do you have anything to add to that?
I think Jenna did a really awesome job of talking about that. I think with more of a domestic violence lens, I would just add that people that abuse, they use inequality that exists in the world to their own advantage. And so there is transphobia, homophobia, and people that abuse will use that for their own personal gain. So they may, if they're verbally insulting someone or verbally abusing their partner, they might use some of those nasty homophobic, transphobic remarks. They might use threats. They might threaten to out them when they're not ready, and all of that's going to keep the person who's being victimized under their power and control. And we'll see that that's happening in similar ways because of the coronavirus. People that harm are using the coronavirus also to their own gain, so they can manipulate the situation and have power and control over the person they're hurting.
Yeah, thank you all for making those connections. And I think I would just add, you know, we get folks that reach out to us and have these experiences right here in the Upstate, sexual assault and domestic violence and intimate partner violence as well. And I pulled just a couple of statistics that I think might be helpful to just sort of see those disparities. So among bisexual women, 61% have experienced domestic violence. Among lesbian women, 43%. And then in comparison, let me rephrase that, 35% of heterosexual women. So you can see that sort of the differences there. And then with men, 26% of gay men have experienced domestic violence, 37% of bisexual men, and 29% of heterosexual men. So I just wanted to include those. And then within the LGBTQ plus community, there are subpopulations within the community who are at higher risk of both domestic violence and sexual assault, like Black LGBTQ plus community members, trans folks as well. So just wanted to include those statistics. So here in the Upstate, because of cultural, political, legal landscape, it's common for LGBTQ plus people to have distrust, rightly so, of service providers. So what steps have your agencies taken to make sure that you create an affirming environment for LGBTQ plus people? And let's start with Anna over at Safe Harbor.
Yeah, thanks for those stats, Ethan. So I just want to say that those concerns and fears or anxieties are all really valid, unfortunately. And at Safe Harbor, I'm gonna say that we are a work in progress. We are not perfect by any means, but I am proud to be at an organization that has leadership who's interested in making sure that we are continuously growing and learning. So I would say that I would hope that people who are in the LGBTQ plus community that need our services could reach out to us. And if it's not a great experience, I would hope that we could have a conversation about it so that we could learn, because there are no people that openly identify as LGBTQ plus in our organization. And we know that domestic violence is often seen as like a women's issue. And there are reasons for that, but it also blocks and erases a lot of people who don't identify as women, and that's problematic. So I just think that it's important for Safe Harbor to continue to work with Pride Link and with people that would generously share with us if we missed the mark or something. Yeah, thanks for the opportunity to share that.
Thanks, Anna. Jenna, how about your organization?
I'll echo Anna's sentiments that, you know, we've worked really hard. I've been with the agency for over 6 years, and you know, we've gone through several diversity and inclusion trainings, including cultural competency trainings with SC Equality. And, you know, we are far, far from perfect. And we've made a lot of changes over the years in making sure that we're using gender neutral terms on our forms, working with both adults and children, changing a lot of the methodology that we're utilizing when we are doing intakes, when we're first interacting with clients, and making sure that we're not misgendering someone and we're appropriately using pronouns. I'll also add that you know, in our recent future, our recent past, we've changed our bathrooms to being gender neutral. So we're continuing to work in progress. I, as well as Anna, would love to hear feedback. If anybody in the LGBTQ community has had a negative experience or an experience they'd like to give feedback on with service providers within our agency, it is our goal to be client-centered, and it's our hope to be able to serve all clients of sexual violence. Like Anna said, Julie Valentine Center is often associated as a women and children's agency, but we serve all survivors of sexual assault, all survivors of child sexual abuse. We do have several male support groups on site and online right now. We're providing services to anybody who's in need of healing services. So it's our hope to always make improvements, and would love more feedback from clients who have worked with us, because we only want to be able to provide the best trauma-informed care for our clients.
Great. Thank you all so much for just that explanation, and also acknowledging that you've got work to do and being willing to do the work. And I think this is a great avenue to continue that work, and partnering with a queer-led organization is one step towards that. So I appreciate the work that y'all do. Anna, with the current pandemic, folks having to stay at home or stay in place, and the increase in stress that brings, how is this whole situation affecting people's experiences of these issues?
Yeah, so there's evidence that when there are times of stress, domestic violence increases. A big example I've seen is during Hurricane Katrina, there were a lot more domestic violence calls, and Greenville PD mentioned that they have, that in March of 2020, they made, I think, twice as many calls, or received twice as many calls for DV than they did last year in March, because people are encouraged to stay at home and socially distance. Unfortunately, that just puts people at risk who are experiencing abuse at home. I mean, that goes for people who are experiencing intimate partner violence, as well as children who are experiencing abuse at home. And it's very troubling. I think that this pandemic is really showing us the problems that we already have, and it's making them worse, but these problems aren't new. Yeah, do you want me to talk about what Safe Harbor is doing now, or do you want me to talk about that later?
Yeah, we can definitely roll right into that. Just talking about what services exist right now and how to access them would be great.
Yeah, so I'm so thankful to work on a team that is adaptable. We are providing all of our services that we have. We've just had to change them up to make sure that we're being safe. So our shelters have been closed down because it's all community living. There are shared bedrooms, shared kitchens and bathrooms, and it would be multiple families sharing a bedroom. So we closed them down, and we were able to have some funding so we could move people into hotel rooms where people could be more isolated within their own families. And we have been doing that since late March, mid-March, and I'm not exactly sure when we're gonna stop doing that. But for now, we are currently at hotels. All of our community services like advocacy, counseling, it's all being done remotely through teletherapy and other secure platforms. Also, outreach has moved completely online. REP, our prevention team, they developed a curriculum on Google Classroom, and they've been working with the schools that they already work with so that the youth can keep on learning about healthy relationships. And our resale shop recently opened, and they're taking measures to make sure that people are being safe while they're shopping in the store. And I'm happy to answer any other questions that come up afterwards.
Great, yeah, and just a quick reminder, if you have questions, you can go ahead and put those in the Q&A box, and we'll definitely have time for those. Jenna, how about at Julie Valentine Center, what resources and services exist right now during social distancing and coronavirus?
Thank you, Ethan. We are providing, since March, mid-March, we have been working from home. And I just have to say, like Anna, I'm really thankful for the leadership that we have on staff, that we're able to work from home. I know that's a huge privilege. And, I'm really thankful to have a leadership team who has worked really hard to be able to continue serving clients in this way while maintaining health and safety for our staff members, for our clients, and for our volunteers. So currently, the way that we're operating is we're still providing clinical care over telehealth. We are you know, we have a capacity for providing care even in office, but this has provided an opportunity for us to work through even assessments that we were waiting to get through in the past, and adding new therapists to be able to work through those that are usually doing forensic interviews. So we are still providing forensic interviews for children on an emergency basis. I know our outreach team is doing a lot of work through social media, providing self-care with videos online for our clients. And we also provide our online support group 6 times a week now. We were just doing it once a week, and we launched it right before coronavirus really began impacting South Carolina. So we do that 6 times a week and update that every week on social media as well as on our website. And that is a totally anonymous service. So when you log on, you're assigned a random name, and the platform is through RAIN, the Rape and Incest National Network. So we don't know who's on there, and we're just discussing topics in a totally anonymous way and providing support in any way that we can. We also are continuing to provide online care 24 hours a day, 7 days a week through our hotline. Our confidential hotline. We have advocates continuing to provide services. And I think we'll talk about what you can do if you find out if you have been victimized. So I'll wait to finish that, especially right now. But I just really appreciate you having us on here to be able to share about what we're continuing to do.
Yeah, thank y'all so much for getting creative and being on the front lines of these issues. I know that it has taken a lot of creativity, a lot of dedication, and a lot of learning new skills to be able to really adjust agency work to an all or almost all online basis. So I appreciate the work that y'all are doing. Yeah, so let's talk about what can someone do if they're a victim, and what is the process of accessing your services? Jenna, why don't you start?
Thanks, Ethan. We the first way to initiate services with the Julie Valentine Center, I'll say this: it doesn't matter how long ago you experienced trauma, even if it was 40 years ago, it's never too late to be able to receive healing services. That's what we're here for. So just pick up the phone and you can dial our confidential hotline number. That's 864-467-3633. And you can talk with an advocate, do an intake over the phone if you're looking for healing services, or if you're just looking for crisis intervention services. Our advocates can equip you with coping skills and self-care skills if you're having a hard time sleeping at night, or you really need to talk about your case if you've opened up one with law enforcement. If you have been a recent victim of sexual assault or sexual violence, you can still go to the emergency department. I know that can be really scary right now, but we work really closely with the sexual assault nurse examiners at Prisma Health on making sure that clients are getting back into the sane room, which is a totally private room away from COVID patients, and minimizing your risk for getting infected. But we want to make sure that you are able to still receive the same level of care that you deserve. If you are over the age of 18, you have a right to an anonymous sexual assault forensic exam. So you don't have to make a decision right then and there if you want to report to law enforcement. That's not always a decision we want to make whenever we have been impacted by trauma so recently. You actually have a year to decide. Our SANE nurses are prepared to have you talk with an advocate from the Julie Valentine Center if you so choose. And if you decide you do want to report to law enforcement, you can do a non-anonymous exam as well. Know that it's your choice if you do an exam to do all of the exam or do parts of the exam. It's totally up to you, and your consent is very, very important. The one thing I will say that's really important about going to the emergency department is you can go ahead and get treatment for any STIs that you may have received during that sexual assault. And so it's important to go ahead and get treatment for that, as well as any emergency contraception. So those are two things that you can get following a sexual assault, and it is all covered through the Department of Crime Victims Compensation. So those visits for sexual assault forensic exams are covered by the state. You do not have to pay for those exams, and that even if it is anonymous is the case.
Great, thank you. Anna, how about with Safe Harbor?
Yeah, thanks. So to access any of our services, you call our helpline. It's 24/7. It works 24/7. It's confidential. It's free, and it's 1-800-291-2139. I changed my name to that so people can see it easily. It's also all over our website, all over our social media. And you call and you're gonna talk to a trained volunteer or staff member, and you're gonna go through an intake. So we are confidential. Everything's confidential except for the abuse or neglect of a minor or or a vulnerable adult. So we kind of tell you that pretty upfront so that you can decide what you want to share with us. And they're going to ask you questions that are going to kind of gauge what services you may need. Maybe you are a great candidate for emergency shelter. Emergency shelter is for people who are in immediate danger due to domestic violence. And we can accept women, people that identify as women, and children up to 17. Unfortunately, we do not have the capacity to accept men right now because it's community living. I don't really know how that's changed during the hotel stays, but if you want to know, I can find out and talk with you afterwards. We are hoping to one day be able to be more accessible to men and people that identify as men. For the time being, we do not do that, unfortunately. All of our other services, such as advocacy, therapy, child and family therapy, is for anyone who has experienced intimate partner abuse, and that's similar to what Jenna said. So if you have experienced abuse 40, 50 years ago, we can still help with the trauma, and we take a trauma-informed approach. Anything else about accessing our services? I think that's pretty much it. All of our services are free and confidential with those little caveats for mandated reporting.
Great, thank y'all so much. And just a quick statement that this is being recorded, and so we're going to get those phone numbers out. I see that both of you have changed your names to your phone number, so all of that information will be available, and in the recording you can share with your networks and get that information out to folks. So we've had a couple of questions come in the Q&A box. Do you have any suggestions for sex workers who have been abused but are unwilling to go to the hospital? And I'll let whoever wants to take that one go for it.
I'll take that one. Thank you, Ethan. That's a great question. And, you know, in talking about stigmas and concerns, you know, if there were anything that I wanted people to take from this webinar, it's that Julie Valentine Center is a non-judgment, judgment-free zone. We provide services to anyone, and we do not judge what their line of work is. Can understand completely why someone may not want to go to the hospital right now, but still want to be able to receive services. So, you know, like we said, the means in which receiving services right now is all online and or over the phone. And, you know, I think it's always going to be a case-by-case approach in doing case management with someone who's experiencing sexual violence or domestic violence. But for sex workers, you know, making sure that they are and or have a safe place to go. And that may mean that we're doing some resourcing with our community partners to be able to find a safe place. But also, you know, offering free healing services, connecting them with other services in the community that we trust. I think that's a big thing that I want to also say is when we work with a community partner, that's because we trust that they're providing trauma-informed care and they are providing the best quality services. So we're really intentional when we give out referrals to clients, and always want to follow up to make sure that they also had a good interaction and good experience with those agencies as well. But you know, any case management approach is going to be case by case with what that client's needs are, what their safety is in the time being, and making sure that we can, even if we're not able to provide all of the services, connecting them with agencies that can.
Yeah, thank you, Jenna. Another question that came in was if somebody can still receive help if they already have a therapist. So we'll start with Anna and go to Jenna just in case it's either sexual assault or domestic violence.
Yeah, so if you want to receive advocacy, even counseling at Safe Harbor, definitely call. We definitely wouldn't block you from receiving services if you have a therapist already. Some people may want a different direction in therapy, and maybe they'd rather not have not pay for therapy, and maybe a Safe Harbor therapist who works specifically with domestic violence would be better for you. So please call. Yes, that's all I have to say.
Thanks, Anna. It's really common for our clients to see multiple therapists because the type of therapy that we're providing is trauma focused. So we often recommend that if someone is seeing a therapist that they continue doing so because the work that we're doing and processing is trauma specific. So oftentimes it's really helpful to have secondary support to be able to process what's discussed in those trauma-centered environments. I will say the specific type of therapy that we provide, because I realize I haven't shared that yet, is something called EMDR, which stands for eye movement desensitization and reprocessing, as well as cognitive behavioral therapy. And so EMDR is a really effective way to treat PTSD and PTSD-like symptoms, which is really common for those that have experienced sexual violence and domestic violence. Post-traumatic stress disorder is very common among those that have experienced sexual violence. And so EMDR is really effective at treating that. We are certainly not the only place in Greenville you can receive EMDR therapy. We just are the only place, and Anna, correct me if I'm wrong, if you all offer EMDR as well, we're just one of the only places you can receive it for free. And we have found that's a great way to treat those PTSD-like symptoms.
As far as I'm aware, I don't think we provide EMDR therapy.
Yeah, thank you all for answering those questions. Another question that came in was for people that aren't aware of what forensic exams are. Can you describe that a little bit?
I'll take this one. Yes, I'm happy to. So, you know, typically outside of COVID-19 times, we have advocates that respond to the emergency department to provide support step-by-step during those sexual assault forensic exams. You know, I'll be honest, and I like to be as upfront as possible about the sexual assault forensic exams, especially whenever I'm preparing a client for going to the emergency department. They are invasive exams. They are not fun exams. You know, the questions that are being asked are really personal questions that a lot of people don't feel comfortable answering. And they are really timely exams. So oftentimes there's a huge portion of the exam that is taken up by getting details of the assault, getting details of previous sexual experiences that same week, also asking about any surgical or medical history that may show up on the evidentiary exam, collecting evidence. Can be really painful with the pelvic exam and or the rectal exam. You know, it's not pleasant experience. They try to collect evidence if there is evidence. The time frame, if you are over the age of 18, you have 125 hours to go and have that evidence collected. Of course, the more time passes, the less likely they're going to be able to find that evidence. If you've showered, brushed your teeth, eaten, or consumed anything, it may be more challenging. But of course, you know, we understand that people do all of those very normal things, especially after an assault. Showering is a really common way to, it's a really common response after an attack. And I would also add, you know, if that person kissed, bit, licked anywhere on someone's body, they can also collect evidence with a Q-tip anywhere that they can indicate on the body. They also take a blue light over, that's not the proper scientific word for it, but there is a light that they run over to see if there are any bodily fluids on someone's body. And then, you know, one of the most important pieces of the exam, like I spoke about earlier, is a part of the kit is receiving those prophylactic medicines to treat any STIs. They don't do tests in the exam. They just go ahead and treat, because oftentimes those things would not show up for 30 days. So they just want to go ahead and give antibiotics. And we encourage them to eat crackers or snacks at that point, because all of those antibiotics can be upsetting on the stomach. And then also contraception, emergency contraception is also an option. We do encourage all of our clients to go after their medical exams within the next 30 days to do a follow-up visit with a medical provider to do any STI testing and continued care. Upstate is a great resource that we like to refer to for that testing if you don't have a primary medical doctor to do testing. So.
Yeah, thanks for that. I think it's really helpful. And especially when we talk about trauma-informed care, just giving people that information ahead of time can be really helpful, even if it's not the most pleasant experience they're going to have. Just having that knowledge can be really empowering. One question that came in ahead of time was, what can someone do about triggers? So they've had an experience, they're experiencing triggers. How can folks cope with that? And Anna, let's start with you.
Yeah, so I have to be upfront and say that I do not provide direct service to people who have experienced trauma or domestic violence. So I'm just gonna be upfront and say that this is something that I have been learning from my own therapy. My therapist, Regina, shout out to Regina, she encourages me to take a second and like tell myself, like, what's being triggered here? Why am I being triggered? So that I don't react, so I respond. And I think that everyone should listen to themselves, to their own bodies, and come up with boundaries that you have for yourself and different people. Sometimes you might just have to leave. Sometimes you might be able to find ways to respond to that person. And I just think that it just depends on the context and what the trigger is. But I would encourage people to seek help from the Julie Valentine Center and Safe Harbor, or any other organization that has trauma-informed care, because they can work with you specifically to talk with you about your triggers. Because what it has been working for me may not work for you. Our situations, our experiences could be so different that it won't make sense. So I just encourage you to, get individualized help, and know that what happened to you is not your fault, and that what you're going through and experiencing is normal based on something abnormal that happened to you, and there's nothing wrong with you. Your body is trying to protect you.
Yeah, thank you for that, Anna. Jenna, do you have anything to add about triggers?
I don't want to take up too much time and just say, we can walk you through grounding techniques and coping skills and self-care activities over the phone, or if you want to schedule a time to do a telehealth call with me, that's something I can equip you with. Know that triggers are very normal for someone who's experienced trauma. They are our body's natural response and we may be triggered and not even know what caused that trigger. And so we spend a lot of time working with our clients trying to identify what was it that caused this trigger. What can we do in the future to respond to it? You can't prevent triggers from happening because they are a natural response to trauma, but what we can do is work on our body and brain's response to those triggers and how we react. Know that whatever you feel in that moment is totally normal. Whatever your body's doing, whatever your brain and your emotions are doing, it's normal to feel the way that you are, even if you feel like you may be going crazy. You are not. Your body and brain's doing exactly what it's supposed to do. But we can walk you through grounding techniques over the phone. And once again, I'd be happy to schedule an appointment with anybody who wants to do that with crisis intervention over telehealth. We have many advocates that are really well trained and great at walking people through a trigger and why we're experiencing those.
Yeah, thank y'all so much for that. And as I wrap up this last question, for any of the attendees who have some last minute questions, there's still time to put those in the Q&A box. So be sure to do that so we can get those answered. But for community members or friends of folks that they think their friends or people that they know might be a victim or survivor of either sexual assault or domestic violence, what's the best way to respond and provide support? Anna, let's start with you.
Yeah, that's a really great question. People that care about people, which is probably most people, maybe not, but people, we want to help and we have great intentions, but sometimes we do the wrong things. So if you have a friend who is in this bad relationship and you are not caught up with those feelings for that person that's harming them, it might be really clear to you that a partner is really bad for your friend. So it can be really natural for you to want to tell your friend that they need to leave this relationship. It could be really natural for you to tell them that they need to leave. And while that's a great sentiment to have to want to rescue someone, it's actually the wrong thing to do. You need to trust your friend and know that they're the expert in their own survival. They're the expert in their own experience. So the best thing for you to do is kind of start a conversation. And the most important thing you can do is listen to them. So you could start by saying, I'm a little worried about your relationship with X. I care about you and you deserve to be treated really well. And listen to them. They may agree with you, but they may not be ready to take the next step. You need to be patient and non-judgmental because if you pressure them to take steps they're not ready to take or steps they don't want to take, you're kind of closing off this line of communication, which is what they may need. There's a stat that says that it takes women 7 to 9 times to leave their abuser for good. So if someone goes back to the person that harms them, that might just be part of the process. At our website, there is a whole section on how to support a survivor. And that has way more details, but I just want you to keep in mind that you have to be non-judgmental and listen. And don't say anything that would cause them to think that you don't believe them. So if they tell you such and such happened to me, don't say anything like, well, what did you do? Or, well, why did, they say that to you? Remember that abuse is no one's responsibility except for the person who is committing the abuse. I could go on forever, so I'm going to take a step back and let Jenna speak, and I encourage you to look at our website because we have a lot of great information.
Anna, I think you did a great job responding to that question. And a lot of what I would say it mirrors that. Listening is one of the most important things that you can do as a supporter of a survivor. And I think, what we see in a lot of our clients and even the kids that we serve, the most impactful thing in someone's healing journey and their survival process is having someone that they care about believe them whenever they tell them about something like sexual assault. It can be really challenging for someone to share with anybody that they experience that. There's a lot of shame, blame, and guilt already associated with sexual assault. And I guarantee you the person who's experienced that has already blamed themselves a million times for what they're experiencing. So one of the first things that you can say to them is, I believe you. And it is okay not to have words sometimes, because that is an appropriate thing. That's an appropriate reaction. Is, I don't have all the right words to say. I don't have all the right things to say to you. Just know that I'm here for you. And I'm really sorry that you experienced that, but I'm here to listen and support you. The other thing I would say is, never begin a question with why. Like Anna said, that automatically implies that they can carry any of that responsibility for their attack or their assault. The only person responsible for sexual assault or sexual violence or domestic violence is the person perpetrating that violence. You know, one thing I know about domestic violence is people are in the most danger of being killed when they try to leave. And so leave that safety planning and healing to the professionals. And as challenging as it is to step back, boundaries are so important when supporting your friend. Helping absolutely can hurt if you don't know exactly you know, all the right things to say. So one thing I will encourage you with, and it's something that we found a need for, is we created a group called Supporters of Survivors. We're actually going to start holding that again online. It's a 5-week group, and we discuss different topics each week, but it's for loved ones, spouses, family members, friends of survivors who are looking for, you know, when helping hurts, looking for information about boundaries, looking for general information about sexual assault. We're going over myths and facts. We're talking about what you could say, what not to say. We're talking about the spiritual impact of trauma. We really kind of go through and want secondary survivors to know, we understand it's challenging for you as well, and we want to equip you with the best ways to support those in your life that have been impacted by sexual trauma. So that's a great question. Thank you for asking it.
Yeah, thank y'all so much. I think those answers are really important and really helpful for folks, like you said, that really want to help, but maybe don't have the skills and tools to, or experience with this in the past to be able to do so effectively. So as we wrap up, are there any last words of wisdom or resources other than Safe Harbor and Julie Valentine Center that y'all want to make sure that people hear and know about? And either one of you can jump in.
I want to say thanks for tuning in and learning with us. I hope that we can continue this conversation. I would really like to see a world where violence doesn't happen. And I do think it's possible, even though that sounds really cheesy, because I think that we can continue to hold space for these conversations and work with future generations about the way people deserve to be treated. And I think that eventually we can have violence not be a huge crisis the way it is now. Thanks.
And I love that response. I also would love to see a world free of violence. I think what I would leave off and just say, I know that right now things are really stressful and scary. So know that whatever feelings you have right now, trauma aside, I know that's what today's topic was about. Know that whatever you're feeling, it's okay to feel that way. You should never have to apologize for your emotions. You know, rage, anger, all of those things, I think, you know, we're told to be ashamed of those emotions and that we're not supposed to experience them, but you have a right to those emotions. The world continues to spin, and a lot of things are out of our control right now, and that really sucks, and sometimes things suck. And it's okay to be angry. It's okay to be sad. It's okay to be confused and anxious and worried. Just know that you're not alone, and that we have people here to listen and support you if you need to talk, and be okay with not being okay. So.
Yeah, thank y'all so much. I think that that there was a wealth of information in today's webinar, and I really, really appreciate both Anna and Jenna for joining this webinar and just sharing your expertise and resources and information. I hope that everybody attending found it helpful and that you can take this away and either share with your network or better provide support and services to folks that you serve. As a reminder, this is being recorded, so please share that with your networks. It's going to be sent out in an email and posted on social media tomorrow. So thank you all so much for tuning in. Thank you to Safe Harbor and Julie Valentine Center. Be sure to check out pridelink.org and our Facebook and Instagram pages at PrideLinkSC for future PrideLink online workshops and webinars where we are connecting folks to resources, building skills, and offering support during this time. So thank you all so much.